All right, welcome to today's presentation, everyone. My name is Megan Francis. I'm the marketing coordinator here at Updox. Just a few housekeeping notes. The phone lines have been muted as we're recording today's presentation. If you have any questions during the presentation, feel free to click on the questions tab of your GoToWebinar panel and submit those there. I'll try to get to all of the questions toward the end of the presentation. But without further ado, let's go ahead and get started. So today's presentation, we have a special guest speaker. Dr. Phil Boucher joins us from Lincoln, Nebraska. So we're very excited to have him here. So our title for today's webinar is Keep Your Business Thriving While Boosting Patient Engagement. So we're going to discuss a little bit about how important patient engagement is to your practice, as well as how Lincoln Pediatric Group, where Dr. Boucher is a physician, discusses how he uses some of the patient engagement tools accompanied with eMDs Solution Series to really improve his business function. So to get started, before we dive right in, here's a little bit of an agenda for today's presentation. First off, we're going to go through what Updox is, who Updox is, the benefits of patient engagement for your practice. I'm going to introduce Dr. Boucher, our guest speaker. We're going to go through a quick Q&A with him. I'm going to go over exactly how Updox works with eMD Solution Series and go over some of those main solutions that we work with them. So who exactly is Updox? If you haven't heard of Updox through eMD Solution Series or on your own organically, Updox was started about 8 years ago by a doctor to help practices as he was just really frustrated with the lack of software and solutions available for the healthcare industry. So from the very beginning, it's always been our mission to help practices reduce manual operations to make life a little bit easier, to give you all a little bit more time to focus on your patients. So we are a communication platform built by physicians for physicians. We have over 56,000 providers and 300,000 users and always growing. As of right now, we have over 100 EMR integrations covering over 72 million patients, or 18% of the US population. So Updox truly is your single source for patient and provider communication. At its core, Updox is a communication platform, obviously, designed to help the independent physician create the best workflow possible for your practice. We've built solutions, specifically patient engagement solutions that we'll discuss today, that counteract the challenges you face on a daily basis. So obviously, you all know that patient engagement is extremely important to an independent practice. Creating trust between you and your patient only adds to the impact you have on their overall wellness. So there are many suggested ways to improve the influence you have on your patient's health, but we'll go over just 3 right now. So first, patient education. Creating a literate or health literate patient and engagement connects the patients to their own health care, making them a patient advocate. A patient advocate, keeping a fluid line of communication between your patients and their family members or their caregivers, you're better able to maintain aligned goals in their health. So creating these advocates of your patients, not only for their health, it also creates advocates for your practice. So you're not only improving overall wellness of all of your patients, you're improving the loyalty that they have for your practice. And with this patient advocacy, it just betters the outcomes for your patients. So reliance on their care plans can improve patient health and can reduce medical errors. By educating and creating these advocates for your practice and for their own health, you can then rely on your patients to follow the intended care plans for them. And these are just big ways you can boost patient engagement. So improving patient engagement can be accomplished by treating patients as partners, empowering your staff to buy into the patient-centric strategies that you've adopted, enabling your patients to engage directly with you and your staff, and emphasizing engagement in all of your practice initiatives. As long as your full practice is focused on engaging your patients and creating those loyal patients coming back year after year, you should have no problem connecting and keeping them engaged. As long as your staff is willing to connect in the methods that the patients prefer as well, improvement should be inevitable. And studies that I've read recently have shown that when patients and families are partners in planning and making decisions about their care, health outcomes are better, patient experience and satisfaction improves, and often costs are lower. Now, to introduce Dr. Phil Boucher here, he has taken a truly proactive approach to engaging patients and getting them involved in their care, them and their families. So Dr. Boucher is a pediatrician at Lincoln Pediatric Group in Lincoln, Nebraska. Their practice has 12 physicians and 5 physician assistants, so quite a bigger practice. They've been an eMD Solution Series user since 2008 and an Updox user since September 2017. The Updox solutions that they use are our patient engagement tools, which are reminders and blast messaging, with a monthly usage of over 1,900 appointment reminders. And since implementation, they've used almost 3,000 blast messages to directly engage target lists of patients. And correct me if I'm mistaken, Dr. Boucher, but I think it was a 20% increase in physicals for their 7th graders and kindergartners since getting involved with Updox. So without further ado, I'm going to go ahead and get Dr. Boucher on the line. Dr. Boucher, are you there?
Yes.
Perfect.
Thank you.
So I want to first touch base on exactly how you found out about Updox.
I was trying to think back about that, and I think when we first heard about Updox was through one of these partnership emails through eMDs, where we had been working with a different company to get text-based reminders to our patients, and then this partner webinar kind of convinced us that we needed to try something different. And I believe we saw it at a user conference too, or at a patient management conference somewhere as well, and that kind of got the ball rolling. And at the same time, I was hearing more about Updox on a couple listservs for pediatric practice managers I'm in, and then a Facebook group for private practice physicians that I'm in as well.
Awesome. Well, that's really good to hear that people are spreading the word. So when you guys decided to implement Updox, what was the transition like for you and your staff?
Everyone around here is very weary of technology and technology transitions. And so because we've had a few headaches in the past, a few late night phone calls, a few weekends, trying to get things straightened out with tech issues. But I was kind of pressuring my office manager. I was like, let's get on Updox. We signed up. Let's actually implement it and roll over. And everyone was kind of dragging their heels just to make sure that everything was set up correctly. And we picked a date. We rolled it out, and I stopped by midday to see how it was going. Our IT person in the office, just to see if the usual headaches were happening or what, and it was already up and running. So it turned out that it was about as easy as downloading an app onto your phone and pressing opening it, basically, was how easy it was to get it rolled out and transitioned on. So it's very easy.
Awesome. So yeah, I noticed, I did a little bit of snooping, obviously. You guys have been using since September you signed up, but actually using it looked like it took about a week or so to get up and running. But I looked at your account, and obviously you got up and running very quickly because you guys were actually sending out reminders and blast messages almost immediately, and lots of them. So I see it was pretty easy to get set up, and obviously you guys are using them, a lot of them. So now to the impactful part of the webinar. Dr. Boucher has provided me with just a couple use cases relevant to the effect Updox with eMD Solution Series has had on his practice solely. But one use case is during the spring. Now, if I'm wrong, correct me. After the winter season has slowed down a bit, the Lincoln Pediatric Group slows down until the summer months when kindergartners and 7th graders are in need of those physicals, which pushes the practice into overdrive. So the practice took a proactive approach to this influx with the Updox Blast messaging tool, which is tailored messages built directly to give your practice the opportunity to segment different patient lists and then send specific messaging to those lists. So, Dr. Boucher, what kind of messaging did you and your staff create to counteract the downtime to build up your business before springs hit?
Right. So we were kind of, every spring, as Megan was saying, we're kind of faced with this dilemma of we've come out of the winter stick season, and it's nice in a way to have a little break from the fire hose of winter stick season, and things are pretty quiet. Mid-March to mid-May, we have fewer patient visits because everyone's healthy, they're outside doing spring activities, and then everybody gets out of school, and the summer rush begins because there's lots of school physical needs and sports physicals, and everybody wants to get those in during those summer months when they're off school and scheduled around all the vacations and camps and activities that they've got going on, and we get booked pretty solid for those summer months. Some patients then, they have to go elsewhere because we just can't get them in or they can't accommodate our schedule, and we're losing patient visits to urgent care or other offices because of the need to get that done and us unable to accommodate them. So what we were thinking about, our school systems actually allow you to do checkups for the coming year as early as March 1st. And so kindergarten, 7th grade are both two big times where kids all get physicals. It's kind of like their check-in that's required by the school system. And so we thought if we can get these kindergartners in ahead of time, that will be fewer visits taken up by them in the summer, and we'll have more time for our other patients. And so what we did was created a list just based on ages and used Updox to blast all of those patient parents to say, did you know that you can schedule a kindergarten physical now? Come on in. We're not busy. We have appointments this week. And so the messaging helped them to realize that they could schedule now, and it allowed them to click straight through to either set up an appointment or call our office to make an appointment. And I had a pretty dramatic uptick in the number of kindergarten physicals at this time, and I was asking the parents, why did you schedule it now? Why didn't you wait till summer? Well, we got a text message that said we could do it now, and it's so much more convenient. We're going to Disney World this summer, and we have baseball. And so parents really responded to that, and it shifted the burden of summer physicals into the spring when we have more time available. We did the same thing for 7th grade physicals. That's another kind of required touch point in our state for a checkup, and we had similar results. So kids are coming in early, they're getting their vaccines, they're getting caught up to date, we're getting those patient visits and the revenue from that, being accommodating of their schedule, and keeping appointment spots open for the summer.
That's awesome. Yeah, and you're also building that rapport with all of your patients' parents to let them know, we don't want you to kind of miss out on your chance to get your physical, so why not do it early? That's an awesome use case. And so you kind of answered it there, but did your patients react well to this messaging?
Oh, for sure. Myself, I don't like getting phone calls. I don't usually answer the phone when it rings. I just wait till my voicemail gets it, and then I just read the visual voicemail of the call. Parents don't like to answer the phone. They're busy doing other stuff. Our emails, a lot of them aren't opened, and letters definitely aren't opened in a timely manner. But I think that text messaging, is kind of the universal common denominator, that everyone still read their text messages. They don't let thousands of text messages pile up before they get to them. And that's engaging the patients where they are at. So they're on their phones, and it's convenient to just click right through to call our office and schedule that appointment when they read the text message. And parents appreciate that, and then it saves them from having to look through their voicemails, call at a later time, or remember to call at a later time when it's after hours or our phone lines aren't on.
Yeah, and I can second that. As a patient, I definitely would prefer to read a text message versus a call. I'm the same way. I will never answer a call. I'll simply read your voicemail. So I'm exactly the same way. So that with that use case, you're using the reminders, and they're actually able to click into the reminder and confirm or cancel an appointment just based on the preference setting of the practice. And we'll dive in a little deeper into that for our viewers today. But that's a great use case. So all of these cases are great ways to stay connected to your patients in a method that they prefer, not being annoying, not calling them over and over. You can set the preferences however your patient prefers. But aside from making sure that all your patients had their physicals for the year, you were also able to use BLAST as a way to educate parents on a more serious issue, as well as improve those quality measures necessary for MIPS. So can you tell us just a little bit more about how you used it that way?
Right. So the other big use is we are involved in a HPV vaccination measure in the community in some of our insurance products. And for many reasons, mostly associated with the internet, HPV is often a tough sell to parents because they hear a lot of conflicting information on Facebook and other sources. And so we spend a lot of the visits for kids that are 9 and up, talking through about why we believe HPV vaccination is important and what the benefits are and the risks and everything like that. And so what we did is, instead of spending all that time in the room, is try and proactively educate the parents in advance. So if a patient schedules a well check and their child is ages 9 or up, when they get that reminder, it will include the reminder of their appointment. It will include a link to be able to read information about HPV and our practice's stance and read through the most commonly asked questions and answers that we get regarding HPV vaccine. And it's something that it's easy to swap out. If we wanted to put a new link in tomorrow, we could easily just swap that link out for a new link or share a video about HPV vaccine for more information. And parents are able to read that prior to their visit, and we're able to actually monitor click-through rates, and it's been popular. And then we either have a better conversation in the room or their worries are diffused completely. And instead of discussing it all, they're just on board with getting the vaccines right when they arrive for their visit, so they don't have to wait afterwards. So it's helped our workflow to be able to give those vaccines at the start of the visit because the parents are already educated about those vaccines. And this year so far, I haven't even discussed HPV with any parents because by the time I walked into the room, they've already gotten the vaccine because they were informed in advance that they were going to get it and that we recommend it. So for us, it's both a time saver, it improves our quality measures, and then it also provides what we feel like is the best care for our patients.
That's awesome. It's like you're using blast messaging as like a preemptive strike to make sure they're well educated and well informed before they get to the room. That's right. Yeah, that's awesome. And then we, if I can add, we also they're supposed to get a booster 6 months after the first one, and so we're able to put them on a list. And when 6 months come up, they get a text that says, "Hey, please come in, get your booster." If it's the right season, we can also say, come and get your HPV vaccine and your flu shot at the same time, because otherwise they'll get that first shot and then we don't see them back for a year or 2 years, and we still get them the vaccine at that point, but it hurts our quality measures if they don't come back in and get that second dose to complete the series. So killing two birds with one stone. That's awesome. So yeah, as you can see, this practice has obviously overwhelmingly used our patient engagement tools in a positive way and a meaningful way to improve the overall efficiency that they have in their practice, but also engaging patients and building those brand loyalty with their patients and their parents. So by coupling reminders and blast, your practice can start connecting with patients without annoying them, while also creating a loyal and trusting relationship. Well, I want to thank you, Dr. Boucher. This has been very informative for me. I hope everybody on the webinar today gets a lot from that as well. I will go ahead and let you get back to your work for the day, Dr. Boucher, but it's truly been a pleasure to have you on today.
Thank you, Megan. Have a good one.
You too. Well, guys, we're going to go ahead and jump right into the next part of our webinar. As you can see, Dr. Boucher had a lot to say about our blast and reminders tools. I'm going to show you a little bit more about how those work. Alrighty. So before that, this is just a little quote from Dr. Boucher before he jumped off there, just to give you a sense of what Updox does in the background for your practice. So I was shocked when it only took a few hours to transition from our previous reminder service provider to be up and running with Updox. It was so easy to set up and automate and run seamlessly in the background. After speaking with Dr. Boucher the first time, I found out it only took 1 or 2 staff members to actually know what was going on or the change that was happening for it to be up and running in a very limited amount of time. So to give you a little bit more of an idea of what you'll be getting if you were to sign up for Updox, this is what Updox looks like. You can use it anywhere with an internet connection. It is on the go and cloud-based, so you guys can use it on the run if you'd like, or picture it here while you're having coffee. So this is the Updox inbox. This is where we consolidate all of your messages, whether that be your patient engagement messages, your portal messages, or your faxes, incoming direct secure emails. Anything like that will be here and color-coded. Specifically, the significance of the Updox and eMDs partnership, we offer not only the patient engagement tools, but also practice optimization. So with Updox, you get the electronic faxing and document management, which will take care of your big paper problem if you are still using a manual fax machine. Obviously, it gets a little bit cumbersome and very time consuming to go back and forth from the fax machine, scan, rescan, scan it into the chart, send back out, get a failed fax. It's just really cumbersome for your practice and your workflow. But we also have the patient engagement tools, which Dr. Boucher spoke about at length, the appointment reminders, which are fully automated to reduce no-shows, and our blast targeted messaging. So the first one we're going to discuss is the automated appointment reminders. Obviously, this is the most obvious one. With the title of this webinar, we want to talk about patient engagement. The easiest way to engage your patients is definitely by reminding them of their upcoming appointments, the most relevant information you have for them. So Updox reminders helps practices reduce and sometimes even eliminate the no-show rate completely. Free up your staff time spent manually calling, emailing, and reminding your patients. We help backfill those canceled appointment slots, or if you'd like to keep your schedule a little bit more open, you have that option as well. And we help engage patients in their care. And again, another quote from Dr. Boucher here. A lot of his staff don't even know that what's going on or that they've changed systems. It's just running seamlessly in the background of their practice. So this is just a little quick video to show you exactly how you would locate your reminders preferences in the Updox inbox. And it's as easy as this. It's a one-time setup with our support team. You get free training and free support with Updox. So from there, they'll get you set up on all of your patient preferences dependent on your eMD Solution Series database. Working seamlessly with Solution Series, we get you set up and running from there. Like I said, super easy to use, super easy setup to get ahead of that patient experience with these messages. You can preview all of the messages going out. You have the option to customize those messages with personalization tokens. So if you wanted to pull and make sure you're pulling your patient's name into the message, you can do that. You can include different practice settings or practice specifics. So you can add your practice signature, the doctor's signature if you'd like, all in there, making it as personalized as possible, as personalized as your practice wants it to be. You have the option of sending out an email, an SMS text, or a phone call reminder, just all based on your preferences and the preferences of your patients, helping you reach them in a way that they prefer and not annoying them. As Dr. Boucher was talking about, none of us like being called over and over. Well, some of us. My mother loves being called to chat anyone up, but the rest of us tend to like an email or an SMS text message that's easy to respond to without kind of hindering us from getting our day over with. So the reminders options, like I said before, you have the email, you have the telephone call or the text message options. On the phone call, if you do prefer to send out phone calls to your patients, you can use a human voice option that allows you to have that personal touch without having your staff calling over and over to get in touch with patients. And we also have everything auditable. So if you were worried maybe that your messages weren't going through, if you didn't see a confirmation or cancellation come through for one of your patients, you wanted to see if the reminder actually went out, how it went out, what method was used, what time it went out. You can view all of that here and export them if you need to run a report for a doc or if you need to run a report for the entire practice to review. You have all of that information right here in the reminders dashboard. And you can even pull this up on the go. Like I said, it's completely web-based. So if you were running late coming back from lunch and you needed to see if your upcoming appointment right after lunch was actually attending the appointment, you can always look here on the dashboard on your cell phone or anywhere with an internet connection. The next solution we're going to talk about is the one that Dr. Boucher used for educational purposes, as well as getting all of his kindergartners and 7th graders in for their physicals and boosters. So Updox on-demand blast messaging is a significant tool when building out your business. You can get in contact with other physicians and also engaging your patients like you want to. So you can build tailored messages and then segment different patient lists. As Dr. Boucher said, he was able to select just age ranges. So his kindergartners, he could select the 5 to 6 category and then send out the messages just to let them know. Or you can message your full database. It's all dependent on how you want to build it. Some use cases aside from the educational and physicals are happy birthdays. You have inclement weather. If you live on the East Coast like me, the weather is insane. Last week it was 70 degrees and then we came into work and it was snowing all week, and now I think it's 35 today. So obviously there's a need for getting in touch with people on the fly. If your practice closes down or if one of the doctors can't make it in for the day, you definitely want to be able to let all of your patients or appointments know for the day. You can do that with blast messaging. And then again, like Dr. Boucher said, in educational or flu clinic announcements, if you needed everybody to come in to get their flu shot, you can announce it that way. I've also seen this used in referral source nurturing. So you can actually use this to get in touch with other physicians, your referral sources, or even pharmacies to let them know of new offerings you have or new locations you might be opening up. Anybody that's in your eMDs database, you can actually pull over into Updox, build a list from, and send out accordingly. So again, this is how you would get to the blast option in your Updox inbox. And just like our reminder solution, you have the text option, the phone call option, or an email option. You select an out-of-the-box list, or you can build your own list custom to your patients. You can filter it, you can build templates. So if you're constantly sending out a specific message to all of your patients month after month, you guys can actually save those as templates, build them out in your database in Updox, and have them ready for on-the-fly messaging as needed. And just like our reminders, everything is auditable and trackable. You have the option of pulling up that blast dashboard and viewing the messages that you've sent. You can view what list was sent, what message was sent, who it was sent to, the method, when, and whether or not it was delivered. So in that inclement weather use case, if for some reason you see that maybe 3 people on the list did not get your notification that your practice was closed for the day, rather than having your staff call through a list of 150 patients, they can now narrow it down to those 3 people who may not have received the message. So saving a ton of time for your staff and just overall engaging your patients in a better way, a more meaningful way. And this has a little less to do with patient engagement, but more so just about the partnership we have with eMD Solution Series. So all of your messages are going to be consolidated in the universal inbox. Here you can see they're color coded. So any of your cancellation notices, if a patient cancels an appointment, they will come to the top of your inbox. Any blast messages, if a patient for some reason replies to a blast message, it will come to your inbox. But also your faxes, your direct secure messages, any sort of internal communication you're doing with Updox can all be seen right here from the inbox. And with our fax messaging, we offer a dynamic editor. So you're able to manage all of your documents online and in the Updox application. With the editor, you're able to type notes or numerical values. You can freehand draw if you'd like. You can erase certain things if for some reason you're faxing something out to another doctor and you don't want them to see a certain bit of information. You can remove that from the document while the original is still saved. You can highlight. You have the one-click signature, so you can actually download the doctor's signature, so the doc doesn't have to be chased down to actually physically sign a document. You can just tag a doctor in the inbox and they can sign away, and then you can send from there. And then also time and date stamp and checkbox to fill out different forms. And another quick video to just show you how intuitive this application actually is. The editor, this was one of my first times using it. As you can see here, very easy to use. You can edit, redact, highlight different things if you'd like. And then the one-click signature is really the game changer. There it is, and then send it out. So the compose screen in Updox for eMDs Solution Series was designed to mimic the workflow you're already using when you're attaching things to the chart. So simply pick your categories, your subcategories, and send out or file. We also have simultaneous functionality where you're able to send to the EMR and fax out at the same time. So to wrap it all up, I know you guys want to put some more time back in your day. To wrap it all up, truly, Updox is the one-stop shop for all of your practice communication, whether that be faxes and pre-auths being sent out, provider, patient, pharmacy communication. All of that is rolled into one easy-to-use web-based location that you and your staff can all have access to. So how exactly do you get started with Updox? We do have a 15-day free trial where you're able to kind of play with Updox, see if you and your staff will actually see the value in it, how it will work, what workflows you can build. It's completely customizable to your practice. So however you want to build those workflows out, it's possible with Updox. It's no hardware. So once you get signed up, really you just get in touch with our support team. They contact you. They get you up and running. They get your training scheduled. And again, free training, free support, no contract. We are a month-to-month service, similar to a magazine subscription. If for some reason you are not seeing the value of Updox, no worries, cancel, and you can walk away without any sort of long-term contract.